everybody. Vanakkam, namaste. Welcome to yet another afternoon of interesting communiques from Neuberg, facilitated by Neuberg. Today, the topic more appropriate in this time and age, particularly because of a lot of things that we have been hearing so far in the news and, at a loss to explain, is on hypertension and cardiac disease. So all of us are pretty much aware of the close links between hypertension and cardiac disease, and it's among the among the risk factors for CVD. High blood pressure has probably got the strongest correlation. It has a high prevalence worldwide, plus in India. Large cohort studies have established that high BP is an important risk factor for heart failure, atrial fibrillation, chronic kidney disease, heart valve diseases, aortic syndromes, and dementia, in addition to coronary heart disease and stroke. We also know of its sort of lethal combination with diabetes, another largely undetected metabolic disorder, particularly in India. And the good news, however, is that there are studies that show the beneficial effects of lowering the BP, either through medication or lifestyle changes, or both indeed. So to talk to us today about this very, very important topic, we have a panel of experts, and they will share valuable information, crucial data points with us, and hopefully this will be a wonderful learning experience for all of us on this call. I introduce to you Dr. Vivek Mahajan, consultant, Interventional Cardiology, Fortis Hospital, Mumbai. Dr. Vivek is an interventional cardiologist, as I said. He has completed his DM Cardiology from the prestigious PGIMER Chandigarh and has done MD Medicine from the Premier Institute, AIMS in New Delhi. His areas of interest professionally are cardiac interventional surgeries. You will agree that we have an apt panelist for our discussion today with Dr. Vivek. The other panelist on our call today is Dr. Ajith Kn. He is a medical director, clinical and imaging services at Neuberg Diagnostics. Dr. Ajith is a general physician with nearly 10 years experience in clinical practice, and at the moment he is currently medical director, clinical and imaging services at Anand Diagnostic Laboratory. While he is involved in preventive health and wellness services, his areas include clinical diagnosis, naturally, clinical interpretation of lab data, role of technology. So he also holds additional certifications in basic life support, advanced cardiac life support, cardiac technologies for medical practitioners. I welcome you too, Dr. Ajith. Dr. Sandesh Prabhu, the third consultant on our panel today, is a specialist in cardiology and electrophysiology. He's at the Manipal Hospital in Whitefield. And before joining Manipal, he was working as senior consultant and head of Department of Cardiology and Electrophysiology at Narayana Hospital, Bangalore, where he had the credit of starting the electrophysiology section. He also has interest in arrhythmia and heart failure, and he was formerly the associate professor of cardiology at Grant Medical College, Mumbai. So he has multiple other initials that follow his name. At the first instance today, we have with us Dr. Vivek Mahajan, and he will introduce the topic to us, hypertension and its causes, effects, and the diagnosis of hypertension itself. May I request Dr. Vivek to address us, please?
Yeah, thank you so much. Thank you for providing this platform and for the kind introduction. I shall begin right away. Hypertension. I'll be talking about the introduction to hypertension, the prevalence, that is the proportion of people suffering in the society with hypertension, the ill effects, the causes, and the diagnostic methods, and how do you go about diagnosing hypertension. So whenever the heart pumps, The heart is tasked with supplying blood to the entire body and the various organs. So when it pumps, it does with a certain force. So when the heart contracts, the blood pressure inside the arteries rises suddenly, and when the heart relaxes, it comes down again. So when the heart pumps, the rise in the blood pressure, the higher blood pressure is called as the systolic blood pressure, and the lower one, when the heart relaxes, is called as the diastolic blood pressure. So there is a certain agreed limit that this is the normal blood pressure. If that limit is crossed, then the patient is suffering from hypertension. We call him as a patient of hypertension or high blood pressure. So why is this important? This is important because the pressure inside the arteries is the pressure which is faced by the organs which are supplied by these arteries. So the brain, the kidney, the heart, all of them are at the end of this arterial supply. And if the pressure inside these arteries increases, then the brunt of the increased pressure is borne by these organs. So you have already talked about the various ill effects of hypertension. So in the brain, you can have damages to the nervous tissue. It can lead to things such as dementia. In the heart, because of the increased pressure on the heart, because of the high blood pressure, it can lead to heart failure. The kidney can face the brunt of high blood pressure, and it can lead to renal dysfunction or kidney dysfunction, and ultimately kidney failure and dialysis and renal transplant as well. Now we are hearing so many young heart attacks. We are hearing about news every day, some celebrities dying of heart attack after gymming, etc. And this is just the tip of the iceberg. These are the celebrities we are hearing about. But in the society, there are many more people, young people, middle-aged people, who are dying of heart attacks at a premature age. And hypertension is a very important risk factor. How does it affect the heart attacks in these younger patients or in the middle-aged patients? So even if the young patient or the middle-aged patient does not have critical blockages in his coronary arteries, he may be having a 30%, 40%, 50% blockage. But a sudden rise in the blood pressure, a sudden increase in the blood pressure can cause the increased stress on the surface of that blockage. And it could lead to rupture of the blockage, just like a pimple burst and it throws out the dirty material from the on the skin. This blockage is also filled with cholesterol rich material. So because of this increased surge in the blood pressure, that blockage may rupture, that plaque may rupture, and it could extrude that cholesterol material into the bloodstream. And this could lead to clotting of the blood in the bloodstream and lead to complete occlusion, complete obstruction of the blood flow in that artery, leading to things such as heart attacks and stroke. So heart attacks, strokes, dementia, atrial fibrillation, kidney failure, heart failure, all are the ill effects of increased blood pressure. So if I have to put this in a numerical way, if we treat hypertension adequately, if we prevent hypertension, if hypertension is taken out of the society, then we can take care of 60 to 70% of all these diseases. Just by treating one illness, we can prevent 60 to 70% of kidney failures, we can prevent strokes, we can prevent 50 to 60% of heart attacks, we can reduce the proportion of dementia. Such is the magnitude of the problem of hypertension in the society. Again, a disturbing statistic is that in our urban society in India, around 30 to 35% of the patients will be hypertensive with high blood pressure. And the rural areas are also not spared. Around 20 to 25% of the rural population in India is also hypertensive. So this is a massive problem that we are facing and with massive ill effects. Now, you would say, what are the causes of hypertension? Why do some people get hypertension and why do some do not get hypertension? So the mechanism of hypertension are varied. There is no one mechanism. The commonest mechanism is aging. With aging, the arteries of the body gets thickened. They become less elastic. They become rigid tube-like things. And because of that, the blood pressure inside the tubes increases, and this is called a hypertension. But younger people or middle-aged people have certain other mechanisms of hypertension as well. It could be poor salt handling by the kidney. Some people's kidneys are less equipped to throw out the salt from their from the bloodstream, and because of that, the salt is retained in the bloodstream of the patient, and this can again absorb water along with the salt, and this increases the pressure inside the arteries. And this poor salt handling is an important mechanism of the hypertension. Increased stress, increased sympathetic activity. The brain secretes, or the nervous system, the central nervous system secretes certain chemicals which are associated with stress, which is called as the sympathetic nervous system activity. So increased sympathetic nervous system activity can lead to increased pressure in these arteries. Their kidney also secretes certain hormones which can increase the blood pressure. And all these things taken together can contribute to the risk of hypertension. The patient's behavior again contributes to this risk factors. I'm sure the next speaker will talk about the preventive aspect, but in a nutshell, increased salt intake, less exercise, junk foods, lack of fruits and vegetables in your diet, processed foods, and lack of meditation, lack of mental relaxation, all of these contribute to the already prevalent mechanisms of hypertension in the body, and this can lead to increased blood pressure in certain patients. Now, coming to very important thing, how do we diagnose the blood pressure hypertension? Now in the COVID era, everyone knows you get a COVID positive test, you are COVID positive, you get a COVID negative test, you are COVID negative. But here in hypertension there is no such positive or negative test. God did not give us a label of hypertension or no level of hypertension. We just have a number, that is the systolic blood pressure and the diastolic blood pressure. And which what is the cutoff for this hypertension, that has been decided by number of epidemiological trials. A number of trials have been done, and it has been found that beyond a certain blood pressure, the damage to the organ starts occurring, and below this blood pressure, the organs are safe, and that is taken as the normal blood pressure. So various organizations like the American College of Cardiology or the European Society of Cardiology have formed guidelines. These guidelines are based on these studies which we have just talked about. And based on this, the commonest consensus is that the normal blood pressure is usually 130 by 80. Some people, there is some variation in the opinions of certain experts. Some say that it's 140 by 90, but the commonest consensus is 130 by 80 is a good blood pressure to have, and the treatment should begin above 140 by 90 for most of the patients. For very elderly patients, you can wait up to 150 by 90. That will be taken in details by the next speaker as well. So now the question is, who should get his blood pressure checked? When we commonly ask the people, what do you think are the symptoms of hypertension? Do you have hypertension? The person usually replies, I do not have headache. I do not have visual disturbances. I feel perfectly okay. I do not feel any weakness. So I do not have hypertension. But this is a misconception. These symptoms of hypertension are no symptoms of hypertension. Hypertension in 90 to 95% of the patients will be asymptomatic. It will be present in your body. The pressure will be there in your body for the next 15, 20 years. It will continuously damage your organs. And when you develop these symptoms of headache or weakness or visual disturbances, it will be already too late. By then, the kidney would have been fired, the heart would have been gone into failure, there would be dementia, strokes, heart attack. So, the very important message that I want to give is that spread the awareness that the symptoms of hypertension are virtually none, and they are only present when the hypertension exceeds a very certain limit of 200 or 180, 190, and that we do not want the patient to reach. By that time, already the patient is damaged. So the States Preventive Task Force has given a guideline that every patient who is above 18 years of age should be screened for hypertension. If you do not do that, you will be missing 20 to 30% of the people with hypertension for the next 15, 20 years till they develop the symptoms. So you have to be proactive. The people have to be aware that they have to go to the doctor beyond 18 years. Every 5 years, they should screen themselves for hypertension. Otherwise, the hypertension is not going to be picked up. Now, I said that 130 by 80 is taken as the normal BP, and usually people treat above 140 by 90. Now, how do you diagnose the blood pressure? I'll give you an interesting example. Just 2 days back, I had a patient who was visiting a general practitioner with headache and anxiety and all the such symptoms of stress, increased stress. And when she visited the general practitioner, the BP was 200 by 120. The general practitioner immediately started her on a high dose of antihypertensive medication, and within few hours, the patient came with a general weakness and feeling extremely fatigued, sleepy, drowsy. And we checked her blood pressure; it was 90 by 40. So the patient actually did not have hypertension. But when the patient visits a doctor or a clinic or a hospital, there is a natural tendency to get anxious about seeing the doctor, and this leads to an increase in the blood pressure. This is what we call as the white coat hypertension. So the next important message that I want to give is that the blood pressure diagnosis is not a one-time affair. It should not be done on a single day. It has to be done over a period of time. If you treat the hypertension based on a single reading, you are more than likely to go wrong. Okay. So when you are having a patient in the clinic and you suspect that this patient is having high blood pressure, you should either call the patient on multiple occasions, 3 or 4 times, and take multiple readings 10 to 15 minutes apart, making the patient relax, and thereby thereafter you make a diagnosis of hypertension. But still, this is a inaccurate measure. Clinic blood pressure is always higher than the home blood pressure. So the patient's active participation is very necessary to make an accurate diagnosis of hypertension. And this is usually done at a home, because the home environment is the place where the patient is spending most of his time. So what we recommend is the home blood pressure measurement for the patient. So here we ask the patient to get a digital blood pressure measurement machine. It is usually a forearm placed machine. This machine will record the BP of the patient. The BP has to be taken for the 7 days continuously, morning and evening, twice in the morning, twice in the evening, 1 minute apart in the morning, two readings. And the patient has to be seated for 10 minutes before the blood pressure is taken. Doing this, the patient has to keep a note of his blood pressure for the next 7 days. Mind you, if the patient is having certain symptoms of anxiety, or he is not feeling well, then at that time the blood pressure should not be taken. The blood pressure should be taken when the patient is perfectly calm and he is perfectly feeling okay and peaceful. At that time the blood pressure should be taken at the home. Doing this, we get at least 14 sets of reading at your home, and this is a more accurate way of diagnosing the blood pressure. So patient's participation is very important in diagnosing the blood pressure, and this is what we call as the home blood pressure measurement. Some patients will do an error even in this. They will feel anxious while taking the blood pressure themselves. They will think that what is the blood pressure going to come, and because of that the home BP recordings will also go wrong. So we have a further technique which is called as the ambulatory blood pressure measurement. This ambulatory blood pressure measurement is a one-time measurement for 24 hours. It is placed on the arm of the patient for 24 hours, and the patient BP machine records automatically the blood pressure every 30 minutes during the day and during the night time. The patient is not able to see the readings for the first one or two measurements. The patient may feel anxious, what is his BP going to be, but over the next few hours the patient will forget about the blood pressure. The anxiety component will be taken care of. The blood pressure will be measured even during the night, because night is 50% of the day of the time of the life that we spend, and the nighttime blood pressure is also very important. So worldwide, ambulatory blood pressure measurement is very, very important and recommended mode of diagnosing the blood pressure. Home blood pressure measurement is the second best, and the clinic blood pressure is the third. Okay. So here I want to stress that blood pressure measurement is not a one-time diagnosis. It has to be done at your home, and it has to have active participation of the patient. Even after treatment is being given to the patient, the home blood pressure measurement and ambulatory blood pressure measurement have to be carried periodically to find out whether the blood pressure is controlled. So this is how you diagnose the blood pressure. And lastly, along with blood pressure, you have many other associated diseases. You have diabetes, you have cholesterol, you have thyroid issues, you have kidney issues. So the diagnostic evaluation of blood pressure should involve all these tests. It should involve whether your brain is damaged, whether your kidney is damaged, whether your heart is damaged, whether you are having high cholesterol, diabetes, etc. Okay, and lastly, few percentage of young patients will have a treatable cause of hypertension, which is called as the secondary hypertension. If we do some procedure or we give some medication, then the hypertension can be totally cured of in such young patients. But these are very small proportion of patients, that is 10%, and they need special tests. They need special tests to find out this secondary cause of hypertension. But for overall population, 90% of the patient, the hypertension is not curable. It is treatable, and it requires lifetime medicines and measures. And I think with that I have covered everything: introduction, prevalence, ill effects, and causes, risk factors, and modes of diagnosis. Thank you so much for your patient list.
Thank you, Dr. Vivek. I think that was an excellent opener for us. Right from physiology to how to diagnose and the right means, and how the multiple ways of doing it, to just a brief mention about prevention. I think we have a great sort of bird's eye view of the condition itself. Now, may I request Dr. Sandesh to talk about the management or treatment of hypertension.
Good afternoon, everyone. First of all, thank you for this opportunity. And Dr. Vivek, just now he spoke in length about diagnosis of hypertension and prevalence of hypertension. So I'll be touching upon the management of hypertension, where we would be looking at what guidelines are saying as of now, and how to manage, including when to start the medication and all. So as far as the guidelines are concerned, latest guidelines, I mean, what they tell us is that, like in the recent guidelines, they have a slight change they have made, where whatever the blood pressure more than 130, systolic blood pressure more than 130, and diastolic more than 80, that comes under stage one. And they most of the latest guidelines ask for the slightly more stringent control of the blood pressure. The reason for this is that there are various studies which have been done, and which have shown that better control of blood pressure wherever indicated would give a better long-term outcome and reduced damage to end organ damage kind of thing. So to begin with, stage one hypertension, what we call, suppose somebody has a blood pressure more than 130 and 80. Most of them we manage them with non-pharmacological therapy or lifestyle modification, and blood pressure above 140 and 90, we would start medication along with the lifestyle modification. But there are some groups where we might have to start slightly earlier blood pressure medicines, like somebody who already has a pre-existing heart problem, like heart failure, history of heart failure, history of ischemic heart disease, or somebody who is having a diabetes, chronic kidney disease, and elderly patients. They might require slightly earlier starting the medication, even if the blood pressure is in the range 130 to 139 or 80 to 89. This is what we have seen in the latest guidelines. So the reason behind bringing down the cutoff, or starting the blood pressure medication slightly earlier, was the various studies were done which showed that if better blood pressure control and bringing down the blood pressure less than 130/80 showed a significant reduction in cardiovascular death, cardiovascular outcome, and complication rates were noted. So basically, one has to kind of prevent hypertension from the coming at the primordial level itself. So that would be touched upon by the next speaker in the lifestyle modification group. Hello? Am I audible? Yeah, okay. So the most important thing what we should look at is there are some drugs also which can cause these hypertension. Most commonly used drugs which can cause hypertension are non-steroidal anti-inflammatory drugs, which are commonly used over-the-counter medications, and this can also interfere with the blood pressure medications like ACE inhibitors, ARBs, diuretics, beta blockers, which we are commonly using in patients with hypertension. They do interfere with their action, and they can cause secondary hypertension. Other drugs which can cause secondary hypertension, like oral contraceptive pills, hormone replacement therapy, and some other drugs like antidepressant, these all can cause secondary hypertension. Suppose if these are the causes of hypertension, if somebody is taking all these medicines, first of all, that should be kind of stopped and changed to some other medication wherever it is possible. Then comes the lifestyle modification, which has a significant role in blood pressure control. Majority of them, the important of them are like weight loss, healthy dietary lifestyle, and sodium restriction. One can include good amount of potassium in the diet. All these act complementary to each other. Each component of it, like for example, weight loss can help in bringing down the blood pressure by 4 to 5 millimeter. Similarly, dietary change that can help in bringing down the blood pressure by 4 to 5 millimeter of mercury. And before starting the medication, the first line of treatment would be lifestyle modification. As Dr. Vivek said, first of all, diagnosis of hypertension should be made. Many a times this could be just a white coat hypertension. Please don't start the medicine at the first visit of to the clinic itself. The blood pressure has to be diagnosed with multiple readings, multiple possibly home monitoring of the blood pressure also can be used to diagnose the blood pressure. Once the diagnosis of blood pressure is made, the first thing what we would be looking at is lifestyle modification. To start with, you can give 6 months, 3 to 6 months of time for the lifestyle modification. Many a times, especially in younger population, they respond very well to the lifestyle modification. As Dr. Vivek said, see, in elderly population, what happens? Blood pressure is because of stiffening of the arterioles or arteries. But in younger population, other causes could be there. So they respond very well to the lifestyle modification. And suppose if after 3 to 6 months of lifestyle modification, still the blood pressure remains on the higher side, one should start medication along with the lifestyle modification. And to begin with, you can start with a single tablet. There are various medications which are available. Out of that, the first line antihypertensive drugs which we use commonly are calcium channel blockers, ACE inhibitors, ARBs, and diuretics, which are the most commonly used drugs. But usually we can start with one tablet at a time, and possibly monthly visits should be, patient should be followed up monthly basis, so that to see the response to the antihypertensive medication. Suppose if he is not responding, possibly increasing the dose and possibly adding the second drug should be planned accordingly. And when you are very clear that what is the patient's requirement of the medication, possibly fixed dose combination can be tried, wherein the compliance of the medication would be maintained with the fixed dose combinations. Because when you put them on couple of medicines, the possibly they might not take some of the medicines, or they might not they might miss out on some of the medicines. And when it comes to blood pressure control in the elderly, there has been significant benefit in the elderly population also, in the form of reduction in the heart failure, reduction in the atrial fibrillation, reduction in the renal complications, and especially even the neurological deterioration. For example, mild cognitive impairment, which was seen in the which is majority, it's seen in the majority of the elderly population, is seen to be at a less, will be reduced with the better control of the blood pressure. So try to kind of avoid these major takeaway points from the management of hypertension is avoid medications which can cause blood pressure, secondary hypertension, and try to kind of include lifestyle modification as the first instance. Suppose if they are not responding to that, possibly adding on medication would be a better option. And intensive blood pressure control definitely helps in preventing the complication, end organ damage in majority of the population. And home monitoring and self monitoring of the blood pressure should be made use of, and they can help to a great extent. There are some myths which we see usually in the general population around hypertension and treatment of hypertension. Many patients come and say, hypertension, I'm too young for hypertension. But what we should make them realize is blood pressure can happen at any age. Even kids can have hypertension, and untreated hypertension can damage to majority of the end organs. And other myth is that once blood pressure medication is started, you have to take lifelong. That is also not true, because there are so many patients who even after starting the medication, they do such a good lifestyle modification. Over a period, we are able to come off the medication. So it all depends on the how good you are at lifestyle modification as well. And the other myth is that BP medications can damage the kidney, or concerns about the side effects of the BP medicines we see very commonly in the practice. But most of the medicines which are used, they are safe, and they are some of them are renoprotective also, means they save the kidney from the end organ damage. And most of the medicines which are used currently are free from major side effects. And if there is any side effect which is noted during the medication, it can be changed, and it can be some other class of medication can be started to those patients. That's what I want to tell. Thank you very much.
Thank you so much, Doctor. I think it's crystal clear, apart from describing the stages and of hypertension itself and the progress of hypertension in a person's life. I think you've conveyed the message that stringent control is absolutely important for hypertension, in order that we can prevent other complications as a result of it. So we now will have to move on to talk about the prevention aspects. Both our speakers have already covered some aspects in terms of lifestyle by mentioning lifestyle management. So without further ado, can I ask Dr. Ajith to talk about preventive management of hypertension, prevention, lifestyle interventions, and what other things can we do in order to prevent the onset of hypertension?
Thank you. Am I audible? Yeah. Could I share my screen, please? Yes. So very good afternoon to one and all. We are trying to see here to see how we can prevent hypertension. As we have learned from our expert speakers, hypertension is by and large a silent killer. Why I say that it is a silent killer is most of us are not even aware that our blood pressures are high. It's really surprising that at least 30 to 40% of us may not have even checked our blood pressures even once. And that's a fact. I think what we see in our clinical practice, as Dr. Vivek was just saying, it's just a tip of an iceberg. So let's just reflect upon what the data says. And we recently see that there is this data that has come out from the National Family Health Survey that's done by the Government of India. The numbers are not surprising. There are about 21% of women who are hypertensive, and there are about 24% of men who are hypertensive. But what is more surprising is that there's a larger section of people, especially women and men, who are pre-hypertensive. So we understand the magnitude and the burden of the problem that we are seeing. If you look at the prevalence of hypertension that we see, you notice that at least, if I could share my screen, please. Is this my screen that I'm sharing? Okay. So what we see is that the hypertension in the age group of 25 to 50 years is on the rise. And that's an economically productive age group that we are coming across. And we are also seeing most of them with complications. I'm sure Dr. Sandesh and Dr. Vivek would be seeing a larger section of these people in their practice. Some of them are ending up in hospitals either with myocardial infarction, or probably an arrhythmia, or probably an end-stage kidney disease. So old saying goes, an ounce of prevention is worth a pound of cure. So how do we go about preventing blood pressures? How do we nip it in the bud? The most important step here is awareness, creating awareness among general public about hypertension. By and large, as we learn from our expert speakers, there are not many symptoms. So people are not aware that they could be having blood pressure. So awareness campaigns in the media, in the print, some workshops, and most importantly, what I believe is primary setting is an opportunistic testing. So whenever you visit a healthcare center, it's always important that we get our blood pressures checked. Just like we get our height, weight, and blood sugars checked, it's important that we get our blood pressures checked. And the government of India also recognizes this. If you look at the National Health Mission and the National Health Programs, there has been a lot of emphasis on preventing diabetes and hypertension. So how do we go about preventing hypertension? We talk about lifestyle management, and both the expert speakers have now and again emphasized on lifestyle management. So when we look at risk factors for hypertension, we broadly categorize them into modifiable risk factors and non-modifiable risk factors. So non-modifiable risk factors is age. As we are growing older, age itself puts us at risk for hypertension. Our gender, they say that male genders are more vulnerable for hypertension, but that divide is kind of blurred right now because we see that the survey throws up the numbers wherein there's not much of a gender difference. What we also see is some genetic factors, and some of these are non-modifiable. But we look at modifiable risk factors. So what are the modifiable risk factors that can help prevent hypertension? The most important is the body weight. Obesity is known to be associated with hypertension. People who are overweight, people who are on the higher side of the scale are known to have high blood pressures. The ideal BMI that we talk about for Indians, the cutoff is 22.9, whereas that for a Western population is 24.9. What we also come across in our population is centripetal obesity. We see a lot of us with the paunch. The hip is to waist ratio is quite high. The visceral fat is also quite high. Most important modifiable risk factor that can help prevent hypertension is definitely body weight. The other important factor is physical with the urbanization, the lifestyle, our physical activity has become more or less nothing. So it's important that we get some regular exercise. And the recommendation here is about 30 to 40 minutes of mild to moderate intensity exercises. It could be walking, it could be cycling, it could be swimming, or it could be a game of badminton, or it could be a game of football. So whatever kind of physical activity helps reduce the blood pressure. So what I would suggest all my patients and friends in my practice is to start walking, because walking is one, safe. You don't have to invest anything in walking. It's just about 30 to 40 minutes of your time. And with the latest gadgets around, I always say that do that 8,000, 10,000 steps a day. That goes a long way in preventing hypertension. Some of us, over enthusiastic, want to start off with a high intensity exercise. A word of caution here to most of them is please start off gradually. Please ensure you get a cardiology clearance before you start off with high intensity exercises, especially if you're doing weight trainings, if you're doing high intensity yoga, if you're into trekking, if you're into adventure sports. Please do check with your primary physician. Please check with your cardiologist if you're medically fit to carry out these activities. So one, look at reducing weight. Two, get going, get moving. That's more important to reduce blood pressure. The most important modifiable risk factor that we talk about is diet. And there has been a lot of research and the cause and effect relationship that has come out of research that increased consumption of salt is likely to increase blood pressure. So it's important that we reduce the amount of salt diet. What we notice here is that most of us are on a high salt diet. Processed foods, fast foods are known to increase consumption of salt, thereby increasing our blood pressure. So the recommendation, what we call as diet approaches against or stopping hypertension, the DASH recommends that the salt grams per day. So as Dr. Sandesh was talking about salt, each gram of salt may likely to increase your blood pressure by about 5. By reducing we'll have a higher blood pressure. Fruits, which are a good potassium, against hypertension. So people who consume fruits regularly are less likely to have one, reduce the salt intake. Two, get the seasonal fruits, have seasonal fruits. Three, be on a fiber-rich diet. So these are the three simple mantras that can help one maintain their blood pressure. Fourth is the habits. We are seeing that urban a lot of people are addicted to smoking, addicted to alcohol. Consume excessive likely effect on the growing baby as well as the mother. Well known, women who are planning for pregnancy or women who are pregnant are strictly advised not to have alcohol, as that is likely to put them and their baby at risk for hypertension and its complication in pregnancy. Smoking per se is not directly related, but what they say is smoking is associated with other heart diseases which coexist with hypertension, especially the clotting disorders, and the risk of having a heart attack is much higher in smoking. So smoking cessation is known to reduce the risks that can be associated with high blood pressures and heart disease in general. Most important other factors which is known to cause blood pressure is stress, and how do we handle stress is known to define our health. Yoga has known to be and proven to be a very effective tool in stress management. So I would suggest people who are fond of yoga, I think that's excellent and a very scientifically proven tool that could help prevent blood pressures. The other most common factor that we have taken for granted is our sleep. Most of us sleep late in the night. Most of us are not even concerned about sleep and sleep hygiene. Obstructive sleep apnea is on a rise. Obesity is on a rise. All are known to be risk factors for hypertension. So sleep hygiene and sleep is extremely important, especially 9 p.m. or 9 p.m. 5 a.m. sleep, or at least 10 p.m. to 5 is very, very important, and an important factor that rejuvenates the cells and helps the stress hormones be on the lower, thereby managing our blood pressures. So if there were two important take-home messages that I would give out to all the listeners out there is: one, be physically more active; two, have seasonal fruits; three, have a good sleep hygiene; four, ensure you maintain your ideal body weight. I think these are three simple prong approaches which can help reduce blood pressure. And most important driving point is, please get your blood pressures checked. Wherever there's an opportunity, please get yourself checked. It doesn't cost you anything. It's not painful. And it's quite easy. There are a lot of gadgets around. It doesn't really matter. Important is the practice to get yourself checked. So my take-home message to all the listeners is, please get your blood pressures checked today. No additional salt in the diet. Get moving. Have a lot of seasonal fruits and be happy. This is the simple mantras that can help you prevent blood pressure. Thank you.
Thank you so much, Dr. Ajith. I think you know you not only did a great job with listing out the various lifestyle factors, but you also did my job by summing it up at the end. So thank you for that very enlightening speech. So our speakers have finished uh, their presentation. So we would like to ask the journalists to come forward and ask the questions, please.
Yeah, there's a question for all three. I'm Pearl from India. So I a little bit, which is my question is there is some noise in the background. Yeah, I'm audible now. All right. So this question had arisen when two of the doctors who were panelists had spoken, and the questions: has there been an increase in the reportage of cardiac arrests over the years in the last few years post gymming? Because gymming was one of the factors that was mentioned during the talk. So do we see cardiac arrests increasing, or cardiac issues increasing after gymming? The reportage of them, and what has contributed to this number of cases coming up, and what are the do's and don'ts that you recommend for cardiac arrests in patients who are currently undergoing
Yeah, any one of you, all, I mean, all three, it's directed to all three. So whoever wants to go first.
I think,
Yeah.
yeah.
Please go.
Yeah, the most important aspect before high intensity, as I was talking about, is to get your blood pressure before carrying out any of these exercises. Most of them could be undiagnosed, and some of them, a small fraction of them, would also may have congenital heart disease, which is not diagnosed, and high put them at risk for sudden cardiac. It's important that you either meet a physician to understand basic do's and don'ts. My suggestion to all those who are exercising or who intend to exercise is to start off gradually. Be patient, exercises, and if you notice any hint of discomfort, for instance, chest pain, breathlessness, dizziness, uneasiness, please stop and get yourself checked with the doctor first.
Hello? Hello?
Yes, please go ahead.
Can you hear me?
Yes.
My name is Syed from Corporate News. Hello? Can you hear me?
Go ahead.
My name is my name is Syed from Corporate News. Which is the ideal time to take the medicine for BP, whether in the morning, after breakfast, after or dinner in the night, after dinner?
Shall I answer this? Yeah. Previously there were few trials which said that if you take the medications at night, then your risk of cardiac events and other events is lesser. This was primarily because the medicines which were available previously, they were not very long acting medications. And what happened, if you take the medications morning time, by the time of next 4 a.m., next day 4 a.m. or 3 a.m., the effect of the drug used to get lost. Okay, so the 24 hours coverage of medications was not there with some of the medications in the past. And because of this, some of the trials in the past have shown that if you take the medications in the evening time, then the risk of cardiac events and other events is lesser. Your if you take the drugs in the evening time. But of late, there is a new trial which is called as the time trial. The time trial again had a look at this aspect when they compared the patients who are taking medications in the morning and medications in the evening. And they found just a small difference of benefit in the patients taking the medications in the evening. So as of now, the guidelines do not recommend any specific time which you have to take the medications. They say have to take your medications regularly at a time which is convenient to you, because just by trying to follow the night time, if it is not convenient to you, it is not desirable that you miss the medication. So whichever time is desirable to you, a fixed time should be taken for the medications. Of course, there is a small evidence which favors the night time, but if you are not able to take medication at night time, at least take the fixed time which is convenient to you.
Or the last question, once my BP is back to the normal, can I stop the tablet?
No, you can't stop the drug unless the BP is below, is causing some medication, is causing some side effect to you, like hypotension, blood pressure, or giddiness, weakness, or the blood pressure is going too low on your monitoring, say 110 or between 100 and 110, then you can slightly reduce the power of medications. You can suppose you are taking two medications, then and your blood pressure is coming a little bit low, 100 and 110 systolic and 70 or 80 diastolic. And what you can do is, over a period, if this is happening, then you can see your physician, ask him to reduce the dose of one of the medicine by half, then again monitor weeks or months. If the blood pressure is still coming low, then go again reduce by half and the medications. What happens if you suddenly take off all the medications? It could be a transient low blood pressure that you are having. Maybe you are having runny nose or fever or loose motion, that could give rise to low blood pressure. So over a period of time, the blood pressure has to be low. Over a period of 2-3 months, if it's coming around 110 or 70, then you can think of reducing the medications gradually. Okay, but in case you are having side effects like giddiness or weakness, then the blood pressure reduction can be, medication reduction can be accelerated.
Hello.
Thank you. Thank you.
Hello, doctor. This is Gopal Raj from City Today News. Okay. How to avoid calcium deposition in our heart valves?
That question nobody will be able to answer because there is no trial or no therapy as of now which has been shown to reduce the calcium deposition in your heart walls or the arteries. It is a process which is associated with aging, or it is a process which is associated with pathological or disease processes going on in the walls. So the best way to avoid calcification in your walls or in the arteries is to keep them healthy. And how do you keep them healthy? You have to listen to Dr. The third speaker, our third speaker's advice to follow a healthy lifestyle. By doing that, you can keep your arteries healthy, you can keep your heart walls healthy. And by that, if the walls are healthy, arteries are healthy, then the chances of calcifications are very, very low. Yes,
Only this is preventive measures, right?
there is no technology as of now. Some vitamin K tablets which are supposed to reduce the calcium in the content in the arteries, but that is not very strongly proven.
Thank you, doctor.
I think
Uh,
Sushmita has
yeah,
been asking. Yeah. So Sushmita, do you want to ask a question?
yeah. Hello, everyone. I'm Sushmita Panda from Financial Express. So, all of you talked about like diagnosis and preventive measures that should be taken with hypertension. So, I have a confusion regarding the diagnosis of the white coat hypertension. So, I have read up about that Telma 40 is given to lower blood pressure, if I'm not wrong, Telma 40. So, as you mentioned that there has to be a consistent high blood pressure, then only you can diagnose, even after lifestyle modification, then only you can diagnose, no, you have hypertension. But there I have come across some cases where the patients have started the medication right away. So what happens? Suppose they don't have hypertension, but they took the medicine. So what will happen now? Will they have to continue with the hypertension medicine all their lives? So, like,
Yeah.
if you could
Uh,
elaborate on this, thank you.
Anyone would like to take this question or should I answer this?
No, if you do not have hypertension and you start the medication on your own, it could be, see, I mean, one or two high blood pressure readings. It could be just white coat hypertension or maybe coincidental kind of thing, maybe because of some infection, some fever. All those things could be the cause of these high blood pressure. And if you start medication on your own without any, I mean, indication, you will end up having low blood pressure. Then you will have to stop medication and you'll have symptoms because of low blood pressure. So it's not a good thing to start medication like that. One. Second thing is, when I said even after diagnosing hypertension, we usually give couple of days for lifestyle modification to happen, lifestyle modification to help. If that doesn't help, then only we usually start the medication. So it's not a good idea to start medication on your own at the first instance of high blood pressure.
So can I add one point here? So we are usually faced with such patients in our clinical practice. Suppose your patient has already started the medication on his own, and now he is suffering the side effects because maybe he did not have hypertension in the first place and was just started medication. So you are not getting any benefits, you are getting only side effects. So in such a situation, if the patient is complaining of weakness, fatigue, or drowsiness, or an inability to work properly, then we straight away stop that medication if the patient is complaining of symptoms of low blood pressure and you are finding the low blood pressure in your clinical practices. We stop the medication. We tell them to monitor their blood pressure after stopping for next 3 or 4 or 5 or 6 months even, because the medication effect, even though it is written that it is effect will be lost in 1 or 2 months, sometimes the blood pressure, real blood pressure is revealed only after 3 or 4 months after stopping the blood pressure. So we ask them to have an extended blood pressure monitoring after stopping the blood pressure medication, and then depending on the readings which you are getting over a period of 3 or 4 months, we take a decision whether this patient requires the lifetime continuation of the medication or not. On the other hand, if the patient has already started the medication on his own, he is not complaining of any complaints, his blood pressure in your clinic is okay, and now you are faced with a question whether I have to continue this medication lifelong or not, then you again give the patient a home blood pressure measurement machine and you tell them to check the blood pressure for the next 2 3 months. You analyze the readings which are there on this blood pressure machine, along with the medication ongoing. And if the blood pressure is not too low, not below 120/80, and the patient is not developing any symptoms of any side effects, then maybe the patient has actually required that medication and he is doing well on that medication, and you can continue this medication with a extended blood pressure measurement every weekly for the next multiple years. and to see whether the blood pressure is going below 110 or 70. If that is happening, then you can gradually reduce the dose of medication by reducing by half strength of the tablet over a period of time.
To add to what Dr. Vivek and Dr. Sandesh have just spoken, ambulatory blood pressure measurement could be a useful tool in such situations. It's quite often that we see a lot of patients when they walk in for a clinic and the doctor's checking the blood pressure, the pressures are high, or there are patients who may have episodic hypertension. One of the most underutilized tool in clinical practice, especially primary practice, is ambulatory blood pressure measurement. I think there are gadgets available, it's quite affordable. And in such a situation, it helps the treating physician and the cardiologist with the patient's blood pressure data over 24 hours. And if their blood pressures during sleep is normal, or is it dipping, or is it high, which is an important tool in also assessing the risk for cardiac events. So I would encourage a lot of my friends and colleagues in primary practice to use ambulatory blood pressure, because I think that's an important test that could help determine the decision to treat, when to treat or not to treat.
Thank you so much, all of you. But just like basically, suppose you are experiencing symptoms of hypertension, you are supposed to go for lifestyle modification first. If the symptoms persist, then you should go for medication. Like this should be the way.
I think it would be the blood pressure reading that determines treatment, and symptoms may sometimes maybe of some other disease or pathology. So symptoms are not very specific hypertension at times. So the decision to treat should be that of the treating physician or a cardiologist who is examining the patient. Important determining factor is the blood pressure reading. As the speakers have emphasized now and again, it's the blood pressure reading that determines the treatment decisions.
One more point I will make here: the symptoms, there are virtually no symptoms unless you are in a last stage of hypertension, and you should never check your blood pressure or rely on a blood pressure which is taken when you are having symptoms. Because if you are having headache, or if you are having stress, or if feeling anxious or feeling tired, 99% of the times your blood pressure is going to be non-reflective of what your blood pressure actually is. So when you are relying on a blood pressure, it has to be taken when you are perfectly peaceful, perfectly relaxed, and perfectly free of symptoms. When you are having symptoms, the BP is going to be wrong. Those symptoms are not about the blood pressure. That symptoms can give rise to the increased blood pressure and a wrong reading. Do not go by symptoms, as Dr. Ajith has said.
Thank you so much.
Thank you for that, doctors. There's a question on chat. Tirna Chowdhury has asked, when it comes to a trend, which age group are you seeing that is becoming more susceptible to heart attacks owing to hypertension?
So the late middle age, level 50 to 60, are the people who are forming the core group of patients with heart attacks because of hypertension. But even the younger patients are showing an increasing trend of hypertension. But because they are getting a heart attack at younger age, it becomes more sensational and news making than the patients who are actually forming the largest group of population, that is 50 to 60 or 70 patients are the patients who have the majority of heart attacks. Young people also are getting, and the trend is increasing. But do not make a wrong misconception that young people are getting more heart attacks than the elder people.
Right. There's a question from Aldora. Do you recommend that everyone should have BP surveillance, or only a certain population that has comorbidities?
Every patient should, every person on this planet above 18 years should get his blood pressure checked every 5 years.
Also, there's another question from Mr. Gopal Raj about cholesterol. Is cholesterol good or bad? Yes, we can talk about both good cholesterol and bad cholesterol. Dr. Ajith, or
yeah, I think cholesterol's in a certain way is good, and in a certain way it's bad. We have different types of cholesterols. For a lay person, we say it as bad cholesterol and good cholesterol. it's important that it's important to recognize that no single determinant can help us in risk assessment. It's a combination of factors. So if the cholesterols are well controlled, if one's bad cholesterol, the so-called low density lipoproteins or LDL, is known to be more atherogenic, associated with heart disease and stroke. So if there was one cholesterol that we would like to address in general, I think we would be looking at the low density lipoproteins. But we also come across triglycerides, particularly in Indians and Southeast Asians, which is known to be associated with atherosclerosis. So the answer to your question is, yes, it's important cholesterol to lower the blood cholesterol levels. But at the same time, there need not be so much of anxiety and apprehension that should be addressed or attached to cholesterols.
Sir, I have one more question. My name is Syed from Corporate News.
Yeah, please.
Yes, sir.
Actually, if our body gets some rashes, turning into my body gets turning into blue, is it because of low blood pressure or high blood pressure, sir? If I get
yeah, body turning blue is possibly because of low oxygenation or low perfusion, and
but not from low blood pressure.
It can happen if the patient is in shock. But more commonly, what we see is on exposure to cold. If the environment and the climatic conditions are quite cold, there is some amount of vasoconstriction, which means that the blood supply to the peripheral organs or peripheral tissues is less, which gives the appearance of bluish color. Having said that, there are some congenital heart diseases, which I think Dr. Vivek or Dr. Sandesh would be the appropriate people to talk about.
Yeah. So, body going blue, there are multiple situations in which the body can go blue. You can have low oxygen levels, which is the most common cause of body going blue, or it could be because of hypothermia or low temperatures, which can cause a reduction in the blood pressure. If the BP goes very, very low in up to life-threatening situations, then the body can become blue or cold because of the low blood pressures. Apart from that, there are multiple congenital heart diseases which are present since birth or since the formation inside the uterus, like holes in heart with permanent damages to the lungs and the heart. This can give rise to blue coloration of the body. But if you want to ask something more specific, like in what situation you had this blue discoloration, then we would be better equipped to help you.
Hi, hello again. I have another question. So, as you mentioned that everyone above 18 years should get their blood pressures checked. There is a recent trend that I have observed that there are increased incidences of BP among school kids. So, what are the possible causes for that? And is this like, should we just call it as a secondary hypertension, and it can be modified through lifestyle changes, or there are some underlying causal factors? Thank you.
Yeah. So very good question. So in the school kids, secondary hypertension, I would like to repeat that it's a condition where there is a treatable cause, which if removed, that cause is removed, then the hypertension can get cured of. It can be permanently taken care of. So in the young people, around adolescent people, the prevalence of secondary hypertension is 10 to 15 or 20%. But in the younger patients, in the school age kids or teenagers below the adolescent age, then in those the prevalence increases. So there is a 20-30% chance of you having a secondary hypertension, and that percentage increases as you go towards neonatal period or infancy. So the younger the patient, the chances of finding a secondary cause of hypertension is more. All said and done, again in the school age patients, the primary cause of hypertension will be the primary hypertension or essential hypertension, not secondary hypertension. So you will find a secondary hypertension cause only in 30 or 40% of the patients in the school age group as well. In the young school age people also, you will have the essential hypertension or non-secondary hypertension as the primary cause. And what are the causes? Causes are again the same which Dr. Ajith had mentioned: poor lifestyle, overfeeding of the kids, obesity amongst the kids, lack of physical activity, junk foods, lack of fruits and vegetables. Even the school kids are now subjected to substance abuse in multiple schools. So all these risk factors start not only in the teenage or adolescent age; they begin within the school age population itself, and this is the population where education needs to be targeting towards the prevention of hypertension lifestyle, all should be incorporated in the curriculums rather than on Zoom meetings.
There's a couple of questions on chat by Surya. One is, during the pandemic, did you see more prevalence of hypertension? If yes, please do help us with more details. And the second question, which medication usually contributes to hypertension or high BP?
Yeah.
Dr.
Dr.
Sandesh?
Ajith?
Yeah.
Yeah, Dr. Sandesh. Sorry. Dr. Ajith, you can take it.
Yeah, I think there is a marginal increase or spike in blood pressures that we have come across in the last 1 or 2 years, probably because of various reasons. The prevailing pandemic has got everybody stressed out. Isolation measures, apprehension with the loss of job, stress associated with illness and death perhaps could have contributed for a spike in blood pressure. What we have also noticed, work from home has been, I think, a curse on a lot of us, because most of us have been sedentary. Most of us have been indulgent in food, trying out new recipes. So consumption of salt has gone up. We've become more sedentary. And the general stress around has definitely contributed to a marginal increase in the blood pressure readings on an average. As far as medications are concerned, I think most commonly NSAIDs, non-steroidal anti-inflammatory drugs, painkillers is something that we commonly see in our general practice. I would also request Dr. Vivek and Dr. Sandesh to throw some light upon to it.
Yeah. So I would agree with Dr. Ajit. The rise in the blood pressure during the pandemics, I wouldn't say it's very dramatic. It might have slightly increased. But what we are seeing clearly is a rise in the prevalence of diabetes. And all because of, as Dr. Ajit said, sedentary lifestyle, not exercising, junk foods, not having healthy foods because accessibility was very poor during the pandemic lockdowns, etc. So the diabetes prevalence has definitely shown a spike. The blood pressure also has shown a slight spike as compared to the diabetes. But all this is being seen now after the patients are coming to us. During the pandemic, the patients were not accessible to us, or we couldn't go to the patient. And because of that, they had to suffer for this over the last 2 years. And now we are seeing the ill effects of that. We are seeing increasing number of MIs and strokes during the post-pandemic period. As far as the drugs are concerned, NSAIDs are, as Dr. Ajit has said, are very important drugs. These NSAIDs will interfere with the action of ARBs, that is the drugs like telmisartan or ramipril or perindopril. The action of these drugs is blocked by the NSAIDs. The NSAIDs block drugs called as the diuretics. The NSAIDs block the action of drugs such as the beta blockers. So most of the antihypertensive drugs, except for the calcium channel blockers, are affected by taking a NSAIDs concomitantly. So whenever I have a patient who is well controlled on the blood pressure medications for a few years, and she's 60 to 70 years, then coming back to us with a high blood pressure and swelling all over the body and creatinine level, kidney levels test deranged. First thing I ask her, have you gone to an orthopedician or have you gone to a dentist? And the answer comes yes. And then I ask, did they give you a painkiller? The answer comes yes, and it is responsible. Painkillers or NSAIDs, the common ones like Brufen or Combiplam or nimesulide, etc. These are the drugs which will interfere with the action of your blood pressure medication, and they can give rise to a rise in the blood pressure. They can affect your kidney function, and they can cause a water retention in your body. And this can be reversed if you stop the NSAIDs. But if you continue taking them for a long period of time, then the damage may be lasting. And the other group of drugs that are also causing hypertension are the nasal drops, which you get in the for cold, the Otrivin or the nasal drop, phenylephrine. Yeah, those can. There are other Ayurvedic drugs. There are Ayurvedic drugs like Yashti Madhu, Jesh Mad, that can give rise to an increase in the blood pressure and resistant hypertension. There are tobacco can give rise to this increased blood pressure. Steroids, many of the steroid Ayurvedic medications will or homeopathic medication will contain steroids without your knowledge, and they can give rise to a increase in the blood pressure. So these are medications you have to be aware that these medications you should not take without the advice of your physicians, and can give rise to oral this contraceptive pills they can also give rise to increase in the blood pressure.
Sandesh, would you like to come in on this?
Definitely,
Hello?
we have seen an increase in the incidence of hypertension, prevalence of hypertension during the pandemic. One is that increased incidence of, possibly work from home was very common during that period. And not just the blood pressure, we have seen increase in cholesterol, increase in diabetes incidences also. And as both of the doctors just now mentioned, most of the medications like NSAIDs, oral contraceptive pills, other than substance abuse like cocaine, antidepressants, these are the ones which can cause secondary hypertension.
Right. So thank you very much, our wonderful panel, for coming here today and making sure that this was a very, very enlightening experience for all of us on this call. I would like to personally thank Dr. Ajith, Dr. Vivek, and Dr. Sandesh for spending their time, sparing their valuable time to be here and praise us journalists of one of the ticking bombs in terms of healthcare in India today. Thank you so much, and thank you to Neuberg for facilitating this event as well. Thank you for the journalists who have consented to come here and ask some questions that really unraveled issues for us. Thank you so much.
Thank you so much. Thank you for
very
your
much.
Thank you. Bye. See you.
Bye-bye.